Hi everyone, welcome to Hub Bites. I'm Sunil Rege, consultant psychiatrist. If you're new to this channel, we cover all things psychiatry and mental health related. So if that's the thing for you, don't forget to subscribe to our channel. Of course, hit the notification button as well to be informed of videos as they come up. Today, we'll be talking about body dysmorphic disorder. So without further ado, let's jump into it and check out what is body dysmorphic disorder. Body dysmorphic disorder is an under-recognized psychiatric disorder that can have dreadful outcomes for patients, including social isolation, lack of work and relationships, as well as a high risk of depression and suicide. It is characterized by an over-concern with physical appearance, such as an appearance ideal becomes the overwhelming and all-pervasive concern. So the appearance ideal is essentially what is the preoccupation. This has to be a certain way, and it's often related to a body part. If there is a small objectively identifiable cosmetic problem, the BDD patient has a view of it that is both distorted and catastrophic. More often, there is no objective cosmetic problem at all. Yet the patient sees the problem and cannot accept that others cannot. This is not mere vanity, nor are people with body dysmorphic disorder attention-seeking. Rather, they tend to be ashamed, reclusive, and have low self-worth. Now, what are the factors that increase the risk of developing or triggering body dysmorphic disorder? Now, genetics, so having relatives or parents, for example, with body dysmorphic disorder or obsessive compulsive disorder. So body dysmorphic disorder falls under the realm of obsessive compulsive disorders. Negative life experiences such as childhood teasing, neglect, or abuse. Certain personality traits such as perfectionism, societal pressures or expectations of beauty, and of course comorbidities such as having another condition such as anxiety or depression. So again, just having this doesn't mean that every single person who has this will develop BDD, but these are some of the risk factors that are present in individuals with BDD. So signs or symptoms of BDD include, firstly, being extremely preoccupied with a perceived flaw in appearance that to others can't be seen or appears minor. So I've had patients, for example, being very, very concerned about their nose being too big, or for example, a gap between their eyebrows. So lots of these different things related to lips, for example, cheeks, ears, etc. Strong belief that you have a defect in your appearance that makes you ugly or deformed. Belief that others take special notice of your appearance in a negative way or mock you. Engaging in behaviors aimed at fixing or hiding the perceived flaw that are difficult to resist or control, such as frequently checking the mirror, grooming, or skin picking. If you think about BDD, and as I mentioned, it comes under this realm of obsessive compulsive sort of disorders, where, hoarding, trichotillomania, tic-related disorders also occur. So obsessive and tic-related disorders. It's very similar. Body dysmorphic disorder has this preoccupation, perceived flaw, defect, and checking behaviors. In obsessive compulsive disorders, the obsession, as we know, is related to a range of things. Could be religious, superstitions, symmetry, contamination, and then they have checking rituals. So that's where the similarity sort of occurs. Attempting to hide perceived flaws with styling, makeup, or clothes. And sometimes individuals can spend a long time in order to do that. Constantly comparing your appearance with others can result in low self-esteem and can result in depression. Frequently seeking reassurance about your appearance from others. Having perfectionistic tendencies, seeking cosmetic procedures with little satisfaction, and avoiding social situations as a result. So these are some of the signs and symptoms of BDD. If you're looking to learn more about this topic and discover a range of other stimulating psychiatry courses, then don't forget to subscribe to the Academy by PsychScene. How is body dysmorphic disorder diagnosed? So diagnosis is typically based on a psychological or psychiatric evaluation that assesses risk factors, thoughts, feelings, behaviors. The thoughts, feelings, behaviors is interesting because that's the CBT model. Thoughts, cognitions, behaviors, and then we know that cognitions and behaviors often are associated with the emotional aspects as well. Thoughts, feelings, and behaviors. Then we have personal, social, family, medical history, and then symptoms in the DSM. So what are the DSM criteria for BDD? So first, as I mentioned, is a preoccupation with one or more perceived defects or flaws in physical appearance that are not observable or are slight to others. And at some point during the course of the disorder, the individual has performed repetitive behaviors. At some point, mirror checking, excessive grooming, skin picking, reassurance seeking, or mental acts, just constantly comparing his or her appearance with that of others. And it causes significant distress or impairment in social, occupational functioning. And the preoccupation is not better explained by concerns with body fat or weight in an individual whose symptoms meet diagnostic criteria for an eating disorder. So this is important when we think about anorexia nervosa, bulimia nervosa. It's a different set of criteria. Individuals might have checking repeatedly in the mirror, but the thought process is very, very different. We have body image disturbance in anorexia, but anorexia tends to have other symptoms. Here you can see it's a preoccupation of one or more perceived effects of flaws, and then you have sort of checking behaviors associated with it, but it's not explained by concerns with body fat or weight. Okay, so that's how you differentiate between the eating disorders. They can coexist, by the way, so it's not exclusive. So how is body dysmorphic disorder treated? Now, the treatment's actually quite similar to obsessive compulsive disorder. So firstly, we have cognitive behavioral therapy, evidence-based. And here again, the main ones to consider are exposure response prevention, which is exposure, those thoughts resulting in distress, and then preventing the response of checking, for example, or skin picking or other things. And then, as you can see, there is a cognitive component such as challenging automatic negative thoughts about one's body image and learning more flexible ways of thinking. And the therapist, yourself or patient and the psychotherapist can talk about goals for therapy and develop a personalized treatment plan. Medication, now because BDD is thought to be, there is an association related to serotonin in a certain way. Therefore, we do find that SSRIs, just like high-dose SSRIs are prescribed for OCD, the same aspect applies here. The combination tends to work better than one or the other. And of course, family support is also important because family psychoeducation to understand body dysmorphic signs and symptoms are important. It's quite prominent in sort of adolescence, late adolescence, early adulthood, and therefore it becomes important to look at this. Many patients can seek surgery for their perceived defects and flaws, but never results in complete reassurance, right? Of course, becomes really important for the range of cosmetic surgeons, plastic surgeons to rule out disorders like this as well, and sometimes engage with psychiatry, mental health specialists to ensure that this doesn't lead to more harm.
Reconstructive surgery says Gen Z is flocking to plastic surgeons at record numbers. 75% of surgeons reported a spike in demand from clients under age 30. And what in the world are they getting done?
Well, that's a very good question. For years, we've had teenagers come in for rhinoplasty. Well, there is something called body dysmorphic syndrome, and that's when a person perceives a defect in themselves that ruins their life. And it's probably some minor little defect. It may be something that even you and I can't see, but it's something that just devastates them. And you have to be so careful. That isn't the issue, because that's more of a mental health issue.
So I hope that this has given you a good understanding of BDD, body dysmorphic disorder. Thank you so much for watching and supporting this channel. If you liked, leave us a like. And of course, if you want any other videos, any other themes that you'd like me to cover, leave them in the comment section below. And I look forward to seeing you in another edition of Hub Bites. See you soon. Bye-bye. Synthesizing complex material in psychiatry to simplify your practice.